When you are trying to detect a wart, the first thing you should look at is trying to compare it with your normal skin. A wart is a type of virus that will start to show up on your skin. Whether you know it or not, we are all exposed to viruses, and since warts are a type of virus, we can get them like any other virus. A lot of us cannot tell if someone may have a virus when we are around them unless they tell us they have been sick or exposed to someone who has been sick. The same goes for a wart. If you cannot see a wart on someone and you come into contact with them by just shaking their hand, you can get a wart. Even if the person you come in contact with does not have a wart, he could be exposed if he has been around a person who has a wart. We really don't know why some of us are more likely to get a wart than others. The myth about catching a wart from a frog is just that, a myth. You cannot get a wart from a frog. There are methods a person could use to get some relief from a wart. Your dermatologist can suggest some of these methods that would work on you. One method is called the acid method. Using this method will destroy the tissue in the wart. Your dermatologist will give you a prescription that is a solution that you can apply to your wart for a month or two. The acid that your doctor will use is combined with salicylic and also of an acid called lactic. Another way your dermatologist might tell you is called a freezing method. I know all about this method because my husband's dermatologist does this method for his skin cancer. I will say this method is a little painful but is the fastest way to clear warts up. The doctor will use this spray can with a lot of force. The spray comes out pretty heavy and will freeze warts. The freezing actually will burn some. This procedure does not take long, usually only a few minutes. You will also notice in a few days that you may have some blisters that appear after this procedure. Do not be alarmed, they will go away in a few days. This procedure may sound very painful, but it is not that bad. It will get rid of warts. The burning of the procedure won't last very long. In fact, when my husband has it done, he is able to drive back home. One of the last resorts you may consider is what the doctor calls the slash and burn method. If you have tried all the other methods and they just won't work on you, this method will. Your doctor will apply to your skin a local anesthetic. After your doctor has applied this to your skin, you will feel nothing. He will use a needle that is electric, and this type of minor surgery will cut warts out. He can also use a laser to vaporize warts. The only thing that you may have to deal with is a little scarring. So if you are susceptible to getting warts, to remember that you do have an option of many different treatments. Like, subscribe and hit the bell button for notification.